The ICU team is mentioning putting my 71-year-old mother with a tracheostomy and a ventilator and a spinal cord injury in an acute care rehab. What should I do? That's an email that I have here from Sarah, and I'm going to read out the email and answer Sarah's question. My name is Patrick Hutzel from intensivecarehotline.com, and this is another quick tip for families in intensive care. So Sarah says, the ICU team is mentioning putting my 71-year-old mother in an acute care rehab from ICU. She has a spinal cord injury and is paralyzed from the chest down. She was intubated and now has a tracheostomy. They are trying to wean her from the ventilator, but have only had 4 hours of success to wean her off it. Your articles at intensivecarehotline.com suggest a long-term acute care facility should be avoided at all costs. She's on Medicare. The ICU says it will provide better rehabilitation for her, from Sarah. Sarah, thank you so much for reaching out with that question. And, you are right on the money here. You do need to avoid sending your mom from ICU to long-term acute care rehab or long-term acute care facility, because there are disaster areas. And it's not only that I'm suggesting that on my website at intensivecarehotline.com. It's also have a look at their online reviews, see what the people say and how they're voting, right? That would be my recommendation here. See what people are saying online. So really thanking you for sharing this, Sarah, because you are absolutely right to be overly cautious and thoughtful about your mom's situation. So here's a breakdown of what you've been told and what you need to consider very carefully. So let's look at some key facts about long-term acute care hospitals, also LTACs. Well, the hospital and the ICU says it's better rehab for your mom. She needs time to wean off the ventilator. This is the next step after ICU. I mean, these are things that ICUs are saying. Now, the reality is that many, if not most, LTACs, also called acute care rehab, are probably not offering the same level of monitoring, staff ratios, or respiratory care as ICU. For a ventilator-dependent patient with high needs, like your mom, this can be dangerous, risky, and even lethal. So, according to intensivecarehotline.com and backed by experiences from many families and also backed by many online reviews from LTACs, LTACs are not always equipped for unstable or high acuity patients or for patients on ventilation with tracheostomies, because they need close monitoring and ideally daily input from respiratory therapists, ICU trained nurses, intensivists, which LTACs most of the time lack. Rehab, as a matter of fact, in LTACs is often minimal unless the patient is stable enough, and many patients leaving ICU are simply not stable enough. Or I should say, many patients that leave ICU going to LTAC are not stable enough, right? So, as a matter of fact, I even recorded a video or a YouTube live that I've done a while ago, 10 reasons why LTACs in the US are a scam. And I will link to this video in the written version of this blog, because I really do a deep dive there why they need to be avoided at all costs. Now, Medicare considerations. Medicare typically covers LTACs if the patient meets the criteria, like 25 plus day stays, covers inpatient rehab or skilled nursing facilities, depending on the level of need. But Medicare coverage doesn't mean it's the best care setting. Your mom is very vulnerable right now. If anything, Medicare covers the one-size-fits-all approach. It's usually 60 days in ICU, in the US, and then they try to ship patients out to LTAC. However, if your loved one still needs ICU after 60 days, and they do, especially if they're on a ventilator with a tracheostomy, then you should do an appeal. You should challenge it. And we can help you with that. We have helped so many families in intensive care keeping their loved ones in LTAC, in ICU instead of going to LTAC. We have a proven track record for that. So, what are questions you should be asking before agreeing to a transfer? So, First question you need to ask, can't your mum be weaned off the ventilator in ICU first? She's only had 4 hours of weaning, which is not enough time to keep up on ICU level care. Next, what's the staff to patient ratio at the LTAC? Is there 24/7 respiratory therapy, 24/7 ICU nurses, 1-to-1 nurse to patient ratio? Are there intensive care specialists? Is there even a doctor in-house 24/7? And if so, what are their qualifications? What are the rehab services really like? How often will she get physical therapy, OT, like occupational therapy, speech therapy? Are they even experienced with paralyzed ventilated patients? What is the track record of this specific LTAC? Look at infection rates, ventilator weaning success, and family reviews online. Also, will she lose access to more aggressive treatment options if your condition worsens there? So, for example, one advantage of staying in ICU is usually have access to all specialists, cardiologists, nephrologists, neurologists, surgeons. You won't have that in an LTAC. So, what are alternative options? The first alternative option is stay in ICU longer, because your mom will benefit from more ventilator weaning attempts in a better monitored setting. Transfer to a better hospital, one with a high quality spinal cord injury program and ventilator weaning protocol. Ventilator capable skilled nursing facilities in the US, sometimes better staffing than some LTACs, but also needs vetting. And lastly, intensive care at home. Have a look at intensivecareathome.com for your mother as a next step as well. Now, your advocacy matters. You can push back and say, we are not comfortable with the transfer yet. She's only had 4 hours of weaning. We want to exhaust ICU level care and explore a safer alternative. Also ask for a care conference with the attending doctors, respiratory therapist, ICU nurses, case manager, and potentially a director from the LTAC, right? Also, ask for the ICU hospital discharge policy, because I can almost guarantee you they are not allowed to send your mum to an LTAC without your permission, without your consent, right? So, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that by looking up our testimonial section at intensivecarehotline.com. You can see what our clients say there. You can also have a look at looking at our intensivecarehotline.com podcast section, where we have done client interviews, because our advice is absolutely life-changing. Because our advice is life-changing, that means we will help you to improve your life instantly by making sure you make informed decisions, have peace of mind, control, power, influence, making sure your loved one gets best care and treatment always. And you can join a growing number of members and clients that we have helped over the many years, hundreds and hundreds, if not thousands of them. And that's why I do one-on-one consulting and advocacy for families in intensive care via Zoom, phone, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to you and your families directly and handhold you through this process, I also talk to doctors and nurses directly with you on your behalf, or I set you up with the right questions to ask. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care. You can become a member if you go to intensivecarehotline.com, click on the membership link, or go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded exclusively only for our members. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share this video with your friends and families, comment below what you want to see next, what questions and insights you have. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my intensivecarehotline.com email newsletter, and if you're a subscriber to my YouTube channel. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.